Again, episode number 10. So Tuesdays at Taylor, we're back again. Today we are going to talk about SI joint. So we've had a little bit of a rash lately of people coming in that their explanation of pain that they're having in their low back or in their buttock is from their SI joint. So this is kind of a common misconception we see in the orthopedic world, in the chiropractic world, any type of medical world. So we're going to kind of talk about maybe a little bit of a dispel some myths and talk about what actually might be causing your pain. So what is the SI joint? It's this joint right here. So it runs up right here. It's your sacrum and your ilium. It's about right here in this spot right here. So a lot of people come in with pinpoint pain here and even pain that radiates down their leg, into their butt, down their hamstring. And a lot of times they say, oh, my SI joint is out. Well, that's a common thing that people say, but a ton of research came out basically that in people that have pinpoint pain here, 10% of the time it's coming from the SI joint. So that's kind of a crazy stat, right? So less than 10% of the time it's actually coming from here. Over 90% of the time though, it's coming from up above, in their lumbar spine. So the reason that's important is what makes us so special here at Winchester Spine and Sport is diagnosis. So the two treatments for pain that's kind of starting here and pain that's coming from here are totally different. The majority of the time, the SI joint that's very painful, and we do diagnose that with SI joint dysfunction, it's because it's moving too much. So just adjusting it, doing a little muscle work around there isn't always the best option. It feels good for a little bit, but just because it feels good doesn't mean it's right? There's a little joke in there for you. But, so just getting it hammered on over and over and over again, if it's causing your symptoms still, maybe it's that the diagnosis just wasn't quite right, and maybe it's coming from your back. So if you've been paying attention, we kind of talked about a lot of things that can help this, right? So number one, come see us because diagnosis is key. Again, if you have an unstable SI joint, in other words, it's moving too much, we need to do some DNS work, we need to do all sorts of rehab that's going to help build strength in that area. But if it's coming from your back, right, this is what you're going to try, all right? Move your spine backwards, right, forwards, rotate, shift side to side. Does any of that cause pain? Maybe even causes the pain that you're feeling down here. If that's the case, the chances are it's probably not coming from your SI joint, it's probably coming from your lumbar spine. So I hope this kind of answers the question, maybe dispelled some myths. Just remember, just because you're having pain, just because you've been told that you might not have an answer, I promise I'll have an answer for you. So if it's not with me, it's going to be someone that I really trust. So keep bringing in suggestions. I really appreciate all the comments and stuff like that. Stay tuned for next week, Tuesdays at Taylor, and have a great 4th of July.